So I chose the path that I've chosen in medicine, I think because my biggest interest is really in the health of populations and the health of communities. And as I was talking to you about, I have this sort of history of people who have been influential on me in my past. And one of them was this uncle that I had who was a priest in a small town who, really was about the well-being of that community they lived in. I had some mentors in medical school who were big population health.
Dr. Sheps.
Dr.
Right?
Cecil Sheps, yeah. Was
talk about him a little bit.
Well, Cecil Sheps was, I had a number of mentors. He was probably the most famous. He was a very accomplished public health practitioner and then public health researcher, and really understood this issue of population health and how do you really look at the health of an entire population of people as opposed to just looking at individual health problems. And he really helped me understand the value of that and also the enormous amount of potential there was there for a career in that kind of work.
What did he tell you about that?
Well, he was a person who also was very driven by a personal sense of social justice, and that I was very impressionable about that. And when he talked about having a very strong conviction about social justice and that being important, that being something he wanted to make a difference with in his life, I found that very compelling. I found that very attractive. And then his feeling was, for him, the way that was most satisfying was this much broader public health perspective and this idea of working in communities and working with the community, engaging people in communities in sort of resolving their own problems and being the solutions to some of those issues. It is about the health of the community. I care about the health of Mecklenburg County. When I see the Mecklenburg County health statistics every year from here on out, it's going to bother me if those aren't going in the right direction. And that's about everybody. But a lot of what public health does is about social justice. It's about looking at people, looking at communities of people who aren't getting the same benefits, who aren't getting the same improvements in their health, who have very disparate conditions compared to the rest of the population. That public health, that's our job. We look at that, we address that, we try to figure out what's causing that, we try to make some kind of impactful intervention around that.